My name is Matt Broadway-Horner and I'm a cognitive behavioural therapist. For this section I'd like to talk about some top tips with regards to obsessional problems. So an obsessional problem is categorised as intrusive and unwanted thoughts or images, sensations that arrive within the body or in the mind. So these intrusive, unwanted items can be relating to violation of moral code. So there could be certain images around children, around other people, around dirt, around insects, different items and health in particular as well. So feeling as if you have a disease when it isn't there but you're preoccupied with it. So problems like health anxiety are a major point here in looking at how to tackle those difficulties. So one of the top tips would be to look at viewing the difficulty in a different way. So if we look at it as that you're viewing the problem as that you're in a party, so the mind, if we use the analogy here of the mind being this party and you've got all your favourite guests there and you're sat in the chair, but then an intruder comes in and it's, for want of a better word, maybe a homeless person comes in. So the homeless person comes in, they stink, they smell, they've urinated, and yet they're coming into your party and they're talking to your guests, they're drinking your wine, they're eating your food. Now, with the idea of intrusive unwanted thoughts, just imagine you trying to barricade the door and stopping that person from getting in. So where's the attention? Your attention's going to be on the intruder. So where's your back? Your back's to your guests. So the guests that you want to be there, the good, fun, happy guests that you want to be there, you're not paying any attention to them at all. So with treatment, what we would look at is helping you to understand that what we want you to aim for is helping you to be sat in the chair. So that even if the intruder comes in, they drink, they eat, they take the food, they talk to your guests, then actually you can just sit there and spend your time and attention with those guests. And that really is the aim of overcoming obsessional problems. So the next top tip is around developing task confidence. How can we do that when we're so preoccupied with the idea that maybe we overgeneralise and think, well, because I'm not good at one thing, I'm not good at everything. And that's the key here, is to not overgeneralise. So let's look at what it is that you're not particularly confident at and let's break it down. So the analogy that I would use is trying to write with your opposite hand. So I'm right-handed, trying to write with the left hand. How long does it take you to be able to write with the left hand? It takes time, it takes effort, and the more that you troubleshoot, the more that you're able to get that right and perfect the art of writing with the left hand. It's the same sort of thing with developing confidence. Look at what you're wanting to develop in that area. So for example, we've got Jamie who has a problem with presentations. Now he talks to himself and says in the internal dialogue that I'm no good, I have low self-worth, low confidence. But the actual issue is here that he's not very good at presentations. So how can we actually help him do that? Well, let's break it down into manageable tasks. So we have to look at doing small, measurable, achievable and realistic goals in this, so as to help him develop the skill and the task in this area. So we're looking at troubleshooting. So what areas does he need to troubleshoot? Well, he needs to look at maybe developing a skill in accepting and working with criticism, looking at being able to tolerate the light and attention of other people that's focused on him, and to be able to deliver a presentation where he is focused on the task and not on what he perceives other people are thinking about him. And these are three areas for him to focus in on, but with time and diligence we can actually look at developing a task confidence in that area, just like you would look at learning to write with the opposite hand.